if we are speaking, for example, on the electronical health records, generally it is, of course, for example, if we compare two clinics, for example, I have my way of saving these records, and the other clinic has its own way of saving these documents. Yeah, but actually, the legislation and the mandates from the government are the main area, main thing on which should we rely when we are making the electronic health records. Yeah, because it is always better, everything, not only the records but generally everything, it is better when it is more centralized and systematized. Yeah, so if we will decide to make the electronical way, electronical type of the recording, it should be systematized. And for example, if I will need to transfer this information to other clinic, it will be very easy because he will have absolutely the same system. Yeah, so it will it will be much technically very easy to transfer, and it will need less time for understanding and less time to get the information about the specific steps. Yeah, because it will be centralized, and it is much more easier for working with this. Yeah, so for example, to speak about my clinic, 2 years ago, no, sorry, 1 year ago, actually, we were working with the papers. Yeah, and clinical histories which we are having was absolutely we were writing everything on the papers. Yeah, so when we thought about the storaging this everything, it took very big amount of the area in clinic. Yeah, because all of the doctors and my clinic, where I was working, it is very big clinic, and all of the doctors were having a lot of patients, and actually it took a lot of space. Yeah, and also if I wanted to just make the referral to other doctor, it was also a little bit difficult to find, sometimes, I mean, to find the specific patient. Yeah, because the flow of the patients was very big, and if for example, assistant would not go in the morning and find all the histories before we begin to treat, and for example, if the patient was coming in the not with the prescribed appointment, and came to us directly, it was a little bit problem to find his history. Yeah, because it was extra, we needed extra time, and in some cases it was difficult to find some person who had free time to find this history. Yeah, so several months ago we transferred absolutely fully to the electronical field, electronical way of the storaging of these documents. And actually, of course, in the beginning it takes a lot of time, because you should fill electronically a lot of steps and a lot of area, a lot of papers you should fill in. And in the beginning it is a little bit uncomfortable for the patient and for the doctor also, but at the end it is so comfortable, and it takes almost approximately 5 seconds to find and to get to the specific patient, and without any kind of complications. It is very easy and comfortable for you. Yeah, because for example, in the paper way, of course, it is not always located like this. Yeah, maybe it will be located like this, and some of them are put very in the high shelves and so on, and it is not very comfortable on every step to get directly to some patients. So electronically it is very, as I mentioned, very, very comfortable. When we are speaking about the paper type, generally all of the dental clinics are saving the history of the patients in the special envelopes, yeah, or folders, and there should be some kind of the area on these folders which will be just for the information about the patient. Yeah, maybe of course it is always better to use some color, some kind of colored code for the identification, but also there should be an area for some information about the patient. It will be maybe the name or address or telephone number and so on. Yeah, and as I mentioned, this is the most widely used envelopes, and mainly it is acceptable for the dental practice. Yeah, the other type of the way of the storaging the paper records is some kind of the files with the two holes. Yeah, and they are also very easy for the placement of the documents inside, and this kind of folders are having special areas, some kind of pockets where we can put some kind of radiographs or CT scans, with the 3D scans and so on. Yeah, and when it is included in the patient's chart, it is very comfortable because when we want to check these X-rays, it is not we shouldn't it is not necessary to find it separately, but it is included inside. Yeah. So despite of which kind of the envelope or the folder we are using, of course, we need some kind of systematization. Yeah, it means the sorting, the storing, and every effort should be made, and we should pass every step to get the final result. And the final result is to make the retrieval easier. Yeah, the main purpose why we are saving this with the names or with the color codes and so on, to make it easier for the second time to find the exact and specific patient. Yeah. When we're speaking about the color coding, maybe it can be done in the alphabetical system, or maybe in some cases it will be depending on the dentist. Yeah, so for example, if in one clinic it is done with the depending on the names and surnames of the patients. In some cases, maybe it is depending on the doctor. Yeah, so I'm saving all my patients in one folder, and the other doctor is saving his patients in the second folder, and so on. Yeah, I mean the second colored folder, and so on. Of course, it is not very bad, but in the big clinics where there is a lot of doctors, it is always better to have the one central system and not be depending on the dentist. Yeah, and not to have the dental charts of dental records of the separate doctors separately. Because, for example, if I want to find, for example, someone, some John, and me, I am having this patient, and another doctor is having the same named patient, it will be a little bit difficult to find this kind of patient when there is the need of the referral to other field of doctor. So when there is a big percent of the referring of the patients, and big number of the doctors are working in one clinic, it is always better to have one centralized system of the managing these patients' folders. What about the patient's registration and health history forms? Yeah. Of course, these two documents are very familiar, and mainly they are all, both of them are about one person and one clinical situation, but they are having absolutely different, they are containing absolutely different information, but these two forms should be saved in one area. Yeah, maybe it will be one folder, or maybe in the computer in one folder also. What about the Georgia? To say once again, we are having one form where on the first paper you are writing the information about the patients. I mean the personal information. It is about the address, or name, and so on, the working place, and so on. And on the other papers, you are writing the clinical situation. I mean, firstly the general situation, and then the clinical situation of the specific patient. Yeah. In some countries, maybe it will be separately. The patient registration paper will be absolutely separate one, and the health history form separately. Yeah. Generally, it should be focused on the ICD codes, and in Georgia we are having the general systematized type of the health history form. It means that whether I'm going in any clinic in the Georgia, I mean maybe in other city of the Georgia, or also in Tbilisi, but in several different clinics, I will have to fill absolutely the same type of the health history form. Yeah, the main areas, main fields will be the same. But all the clinics can get these kind of general paper forms absolutely easier. Yeah? But of course, most of the clinics want to have some customized types. Yeah, maybe it will be written the name of the clinic, or the name and address and email, and so on. So to custom this general type of the form, history form, it is all of course acceptable, and we can make it absolutely easier with the different kind of the helping of the different companies, and we can add, as I mentioned, some address or specific details or special needs about the specific clinic, yeah, which we are working in. And if we want to make it electronical, in the electronical way, of course, it is also acceptable and very available, yeah, easily acceptable. The patient's registration form is the form where I'm adding the general information about the email, and the address, and the telephone number, and so on. And if the patient is having the insurance, also the information about the insurance company, and the details of his specific health insurance is also included in the registration form. Yeah. And then we are going to the health history form, and as I mentioned, here we are writing down the specific details of the general health and the patient's oral health. Yeah. After we fill this everything, after we made the full and got the full information from the patient's person about the general health, about the parts of the registration registration form, and so on, the main important thing is, as I mentioned, the storage of these records. Yeah. Uh, so um, exactly whether the dental clinic will work in the professional way or not, and if it will be strong as the business is depending on the quality of the storaging the business records. Yeah. It of course takes a lot of time, so we should be prepared for it, and we should get some extra time for it and be prepared that not only clinically the treatment of the patient will be included in our working day and workflow, but also the time we should save time for the documentation. Yeah, for writing down, filling the papers, then to uh, separate them and to make the correct storaging, and put every paper in the correct and appropriate folder, and to be sure that for every folder is filled in the correct way. Yeah. And if there is situation to make the copies or backup for to have the backup folders, of course it is very mm, um, comfortable and useful for us. So how we are making and how we are preparing for the saving the records, yeah, for the storing the records. First of all, of course, there is several steps to make it correctly and comfortable for then finding it once again. So first step, what we should make is to inspect the document. Yeah, inspect the record and check, is it important, is it the folder which should be filled, is it the folder which should we save or not, or should we retain it or not, or maybe we'll erase it or not. So this step is inspecting, and after this, on the next step only goes the documents which should be retained. Yeah. So on the indexing, we should check and determine how we are gonna save the document. Yeah. So it is, for example, if we are making the record and it is for example about the receipt of the payment for the patient, the dentist after the dentist will give the checking from the dentist for the checking account, the administrative assistant should decide, for example, to which folder should this receipt go to. Yeah. So it is absolutely depending on the administrative assistant to make it correctly, the indexing, determining, and go checking it correctly to which folder should go every specific document. Yeah. For example, if we are using the alphabetical system, it is better and easier for the patient's clinical records to use this kind of system. Yeah. And as I mentioned, in some cases, maybe it will be done with the, for example, depending on the patient's name or surname, and so on. Yeah, and depending on the alphabetical way of this determining and indexing these folders, then it will be much more easier to find this kind of documents on the second time when we will need to check it once again. Yeah. So after we will make the indexing, then it is needed to make the coding. Yeah. After the determining and making the writing caption on this. For example, if we are having these kind of folders, and here maybe we'll make the color coding, and then maybe we will need we'll write the caption on the paper. Yeah. Of course, I will tell once again that on the electronic record, this can be done by, for example, creating a name of the file which will describe and which will explain us for what this special document is needed. And on looking on the name, it will be absolutely easy to for us to find the exact purpose of this document. In the clinical record, this coding will be, it is better to be the patient's name, and maybe together with the patient's name, it will be the name of the doctor, or the important part of the information, which is which will give us the main information about the document. Yeah, maybe for example, if it is the treatment document, you will write here the treatment, or maybe if it is financial, you will write the financial, and so on. Yeah, so it will give you the main information. Yeah, highlighting the most important word, which will give you the specification. Yeah. So the next step is the sorting. Yeah. Um, After the coding, the records should be arranged, yeah, in some kind of order, and they should be placed in a specific file. Yeah. So if we are speaking about the electronical files, they are sorted as we are saving, and it is very easy to make it in the correct direction. Yeah. Because the computer, the electronic system is sorting them itself. For example, if we want to make it alphabetically, we can sort it by name, by date, or some by name of the doctor, and so on. Yeah, in the paper type, we are making it ourselves. And before, not before, but after sorting, we need, and the main and the final step is storing. Yeah, so we should put all the necessary same type of the documents together in the folders or in the electronical folders, and it should be it should be organized. Yeah, it should be in some kind of the organized form. So before we go to the final step, and it is storing, we should check and then double check this every step once again. Yeah, because for example, if I stored everything, if I made this every step, if I passed this every step, and I stored the document, and unfortunately I stored it not in the correct folder and not in the correct area, or maybe it was some spelling problem, or I made some little, very little technical mistake, and therefore the name of the patient was not in the correct folder, or the treatment, the name of the folder was not correct, and so on and so on. After several time, when I will need to find this document, it will be absolutely very difficult to find it once again. Yeah, because I don't mean that, for example, I write my name is Nino, yes, and I put the folder, I put my history in the folder of Nina. Yeah, of course, it will be very easy to find, but in some cases, maybe I will put it. It was not treatment document, but it was the financial document. Yeah, and I put it in the treatment document. It will be absolutely very difficult for me to find it. Yeah, because not this amount of documents I'm speaking about, but maybe big clinics are having one whole separate room which is absolutely filled with the documents. Yeah, so in this big amount of documents, when every little mistake is crucial, and if do not put the document from the beginning in the do not store it from the beginning in the correct folder, then you can think that this kind of document is lost. Therefore, before we make the final step of the storing, we should check and double check everything once again to be sure that everything is going correctly. About when we are speaking about the storage of the documents, also we should speak about the cross-referencing and retrieval. Yeah, what is the cross-referencing of the documents? Yeah, the cross-referencing means that the record which we are saving in the, for example, one folder or specific area is also stored somewhere, also elsewhere, yes, somewhere other area. We can make it, as I mentioned, by copying this document or record or some kind of folder and so on. And For example, if it is the paper and sheet, we can make just a copy of this paper. Yeah. So when we are saving the cross-reference sheet, it means that it will save and it will include the name of the document, the date, where and when it was filled, and also very short description of what this document is about. Yeah, if it is about the treatment plan, it will be very shortly written the treatment. If it is, for example, the referral, it will be shortly written what was the reason and so on. And this kind of if it is just making the treatment plan, it will be written very shortly the steps of the treatment plan. Yeah, and this kind the cross reference means this kind of document. Yeah. What about the retrieval type? Retrieval means that when we remove the record from the file, for example, from the electronical way, there is the special files where it is type of the charge out, and for example, when entire file is removed from the folder, this kind of out folder is put instead of this file. Yeah, so I mean the paper files. So if I will remove the file folder from the folder, I put the out folder instead of this paper. Yeah, so it means that when I will need this kind of folder, or I will be asked from the patient to check this history or something, I will know that there was history, there was this kind of document, and it was removed. Yeah, and I will get the information. It will be written there very shortly, all the details about the information, the patient's name, surname, the short information about the overall situation, and so on. Yeah, so it is some kind of reminder that there was some kind of document and it is no longer there. Mm, now what about the retention of the records? And as we mentioned, different type of records are having the different time of the retention. Yeah, but why actually it is necessary to know about the time of the retention? Yeah, because it is not cost effective to save all the records, because in some one day it will fill all your room just with the papers. Yeah, because it is taking a lot of time and not time, sorry, a lot of area and a lot of space. Yeah. So, as I mentioned, many records and most of the records in the dental clinics are retained according to the state statutes. Yeah. If the dental clinic is large, a retention schedule may have been developed for the different documents. Yeah. So, if the office does not have the retention schedule, The administrative assistant or the manager and who is responsible should check with the dentist all the documents before erasing or before destroying or transferring it to the storage. Yeah. What is also very important, we should know and check the state dental board and know all the requirements, the state requirements, which are specific for our individual country. Yeah. About the storaging and retention of the documents, I mean. Because of the dental practice mainly is going little by little from the paper to the electronical records, it is much more, it will be much more practical to store these papers, and maybe because of transferring to the fully to the electronical way, in some years we can save all the documents for a very long time, because it will just need will need just a little extra space, virtual space. Yeah. Maybe from the papers we can just make the scanning type of these papers and save them in this way, but of course in such way it is also the electronical. And if we want to save some paper document and we are just having the problem with the space in the clinic and so on, we can make scanning and save the electronical records. Um, uh, so, and After just this every step, the mainly how we are making the systematization of this storing is having five different systems. Yeah. It can be alphabetical system, it can be geographical system, the numerical system, subject system, and the chronological system. Yeah. The words are telling themselves, and it is very easy to guess which is giving the main information, and which depends on what depends each of these systems. And Generally, the main system which we are using in the dental field is the alphabetical system. Yeah. And more than 19% of the whole filling systems are depending exactly on the alphabetical type. Yeah. Of course, it is very easy to guess that here we are depending on the letters, and of course, A is the first, and so on. Yeah. But here also there is some kind of rules and some kind of steps which are making it easy for us to make the correct uh, identification of the and finding each person very easily on the appointment when we will need it for the second time. Yeah. In some countries, for example, in Georgia, we are having a name and last name. Yeah. In some cases, there is the name, the last name, and the given name. Of course, the main unit on which there is made the indexing of the alphabetical system is the name. Yeah. Sorry, the last name, surname. We are the mainly depending and making this alphabetical system depending on the last name. Yeah. So after this, the first name is followed. Yeah, which is the second to say is the second unit. Yeah. And if in some countries there is the middle name or the initial name, it can be the third unit. Yeah. Um, so when we are speaking about the alphabetical names, and as I mentioned, firstly, we are speaking about the surnames. We are comparing the whole surname letter by letter, yeah, because maybe the first letters will be the same, the second letters also will be the same, and so on. So to have absolutely systematized and correct form of the storing of this, maybe the histories or the charts and so on. We should compare letter by letter surnames, and then check maybe up to the surname as the first name and so on. Yeah, so when we are considering the second units only when the first unit is identical. Yeah, so if the two patients are having the same surname, then we are considering this name. Yeah, so we are considering the middle name when the surname and the name, first name of the patients are the same. So, what happens when the patients are having the same name, the same surname, and we should decide how to manage this list? Yeah. If the names and surnames are having, or if two people are having the same name and surname, they are indexing according to the city where they are living. Yeah, the residence city where they are coming from. If unfortunately the city also is the same, maybe we the next unit on which we should rely is the street on which they are living. Yeah, so generally it is considered that it will be not very often that the patients are having the name and surname and the city absolutely the same, and of course they won't live on the same street. Yeah, so it happens very rarely, but in the some complicated situations we are managing the list like this. Yeah, but generally, as I mentioned, the main is what we are relying on is the surname, then goes the name. If the patient is having the middle name, we are also according and considering this middle name, and I mean letter by letter. And then we are going to the, depending on the city, and checking the name of the city. And then in the most complicated situations, the last step is the street on which the patient is living on. Yeah, so generally, even if we are making the geographical systems, also this also goes like the alphabetical, and the areas which are beginning on the A letter is listed in the upper part of the list, and so on. Yeah, in the chronological system, mainly is the same. So as I mentioned, the general and the most comfortable and the famous system which is used for the classification and for the forming this storaging of the documents is the alphabetical system. It is much more comfortable. So this was generally the information which I wanted to give you today. And tomorrow we are also not tomorrow, sorry, on the Saturday we are gonna speak about the electronical electronical life, which is helping us a lot in the making it easier to work in the dental field. If you do not have any questions, guys, do you have any questions?
How the midterms built?
How the midterms what?
Built.
It will be multiple choice.
Ah, okay. Thank you.
Welcome. Guys, any other question?
No, thank you.
Welcome. Okay, let's meet on Saturday at 11.
Thank you. Bye bye.
Okay, bye.
Okay, thank you, lecturer.
Bye. Bye.
Thank you.
Bye.